There is tremendous overlap between digestive health and mood. And we see this represented in a powerful way in this particular condition, irritable bowel syndrome. Because yes, the criteria are not based upon your mood. The criteria are based upon your gut, based upon your gut symptoms. But the issue is that a huge percentage of these people simultaneously are dealing with mood issues. So it's roughly 50% of people that have irritable bowel syndrome that actually can be diagnosed with major depression or generalized anxiety disorder or both.
50% of people with IBS can be diagnosed with like serious depression or anxiety or
up to
or
50%. At a minimum, 50% are suffering in a way where if you were to measure their mood, compare that to normal people, at a minimum, they're in a depressed mood relative to other people. But it is a very large percentage of people that are potentially able to be diagnosed with one of these two conditions or both, which are mood disorders. So there's this overlap between irritable bowel syndrome and these disorders of our mood. And the question that has come up is like sort of a chicken or egg thing, right? What causes what? And in the past, like in the very beginning, Jonathan, when they first started studying this, they thought that actually it started in the brain and that these people had mood issues, they were depressed. And because they were depressed, they were feeling it in their gut. But then we actually lined up studies where we took a group of people that don't have any of these symptoms. And we track them. You take 5,000 people, track them, and see what comes first. And it's actually quite fascinating. And it teaches us quite a bit, where they discovered that actually most of the time it starts with gut symptoms. By the way, this is the exact same thing that happens in Parkinson's disease, where there's now research that Parkinson's disease starts with constipation and changes in the gut, and then subsequently manifests with a neurologic health condition.
That's amazing. So I just want to make sure, again, that I've heard that right. You're saying Parkinson's, which is this terrible sort of neurological disease, actually starts with gut issues?
Yes, and any gastroenterologist who's listening to the show right now is going to raise their hand to be like, yes, I agree. 100% of my patients that have Parkinson's disease are constipated. They're all constipated. And so is it that they develop Parkinson's disease and then they become constipated? No, the answer is the opposite. They become constipated first and then subsequently develop Parkinson's disease. Two things with this. Number one, if you are listening to this and you suffer with constipation, I don't want you to hear that you're going to develop Parkinson's disease. The odds of that are very small. There are some people that this happens, but the vast majority of people who suffer with constipation, they don't move on to have Parkinson's disease. The point is, in this brain-gut connection that exists, there can be the manifestation of disease in the gut and the manifestation of disease in the brain or in our mood, and they can be happening in a fashion that is actually, they're connected to one another.
And how do we understand this connection today?
There's multiple ways that your gut is talking to your brain right now. As you and I sit here and speak to one another, your gut is talking to your brain. And some of the ways are with the production of chemicals, which are what we call bioactive. So that means they can actually impact the physiology in your body. These chemicals, by the way, are often produced by your gut microbes. 70% of your immune system exists in your gut. And the immune system is able to activate things that can affect the entirety of your body and create inflammation. Also, your hormones and your neurotransmitters that are produced in your gut. So it's interesting, when I finished medical school in 2006, I had learned about serotonin and things like this. And I didn't realize that there's over 30 neurotransmitters. I didn't realize there's that many. I thought there were like 6. There's over 30 neurotransmitters. They are produced in the gut. 90 to 95% of serotonin is produced in the gut, and 50% of dopamine is produced in the gut. And so now these things can have influence in the gut, but also throughout the body. And particularly with serotonin, I just want to be totally clear, because there's going to be someone who's a scientist who's going to want to make sure that I'm clear on this. The serotonin that's produced in your gut does not actually cross into the brain, but there's a precursor to serotonin called 5-hydroxytryptophan. And this 5-HTP actually has the ability to cross into the brain and signal and change how your brain works. And then the last but not least, perhaps the biggest and most important, is a pair of nerves, which are probably my favorite nerves in the entire body, Jonathan. called the vagus nerves. All right. Now, the vagus nerves start in our brain, pass through our skull, and descend down to our gut. And they're collecting information from your gut. There are in your gut 500 million nerves, feeling and sensing by the microsecond. And all that information that gets collected by 500 million nerves, by the way, I should add that 500 million is a ridiculous number. So, I mean, I know that sounds like a lot.
I mean, it sounds ridiculous.
But like just to like compare this to your spinal cord, this is 5 times what you will find in your spinal cord.
Hang on. So I've got 5 times more nerves in my gut, which as far as I'm concerned, I can't have any control over, versus my spinal cord, which ends up controlling, my legs and other things that I know I'm moving around all the time.
That's right. So yeah, so you have 5 times more nerves in your gut. This is why we call it the enteric nervous system. Or some people will call it the second brain. I actually would challenge that. I would call it the first brain. Serious. Well, okay, so here's why. From an evolutionary perspective, for you and I to be here, it required us to evolve and mature a brain, right? But the problem is that a tree can't grow until it puts down roots. The roots must come before the tree grows up. The brain cannot be strong without nutrients. We developed our enteric nervous system before we developed our central nervous system, which is our brain. So from an evolutionary perspective, this actually came first. And these 500 million nerves that we have are constantly feeling and sensing everything that's happening. That includes the immune system. You have 1.3 trillion cells in your gut, all right, that are literally right next door to these nerves. Like they're right there. And then feeling and sensing the 38 trillion microbes that are like across a paper-thin wall that may or may not have holes in it, which is what we call the gut barrier. And there's the 38 trillion cells. They're right there too. And so these nerves get to feel inflammatory cytokines, things that your immune cells create, that's inflammation, and also come into contact with the chemicals that are being produced by your gut microbes. And they collect this information, Jonathan, consolidate it all into 2 nerves that run from your gut all the way up through your chest, past your heart, through your lungs, through your neck, and to your brain. That's the vagus nerve. This is one of the 12 cranial nerves. And then that information, your brain can action based upon this. So this is how the gut is communicating to the brain. Now, flip side, your brain is talking to your gut. And the way that your brain is talking to your gut is through, number 1, the vagus nerve. So about 20% of the fibers in the vagus nerve are for taking information from your brain back down. 80% is sucking up information from 500 million nerves, 20% taking information from your brain back down. Vagus nerve is one, but also your brain produces hormones that can be released by the hypothalamus or the pituitary gland, and that can have physiologic effects throughout your entire body. So like an example of this, if I jump out at you from behind a door and I try to scare you, I would never do this to you, Jonathan. I just want you to know that.
Good.
Okay. But if I jump out at you, that shock gets your heart racing. Your blood pressure goes up. Adrenaline surges. Where does that come from? That's your sympathetic nervous system. Sympathetic nervous system is your action, your get up and go. And your brain actually controls the gas. Your brain is what's pushing the gas on the sympathetic nervous system. And this is one of the ways in which your brain actually can communicate down to the entirety of your gut, because the hormone that your brain is producing, it can impact your gut barrier, it can impact your immune system, and then it can impact the muscle that lines your intestines, which basically means motility.
There's a very complex sort of 2-way thing going here where you're saying an enormous amount of my nerves are like going into my gut, getting information from it, but also that my brain has this ability to create all of these chemicals and other things that then shape the way that my gut is working. So it's sort of going in both directions?
It's going in both directions. And so now thinking about this, the hormone, by the way, for the nerds who are listening, is called corticotropin releasing hormone, or CRH. Okay, so we have CRH receptors, again, in the muscle of our gut. That means motility. We have CRH receptors in our immune cells. That's inflammation. And we have CRH receptors in our gut barrier. And when this CRH in the moments of stress comes down, many people can relate to this. You're feeling stressed out, you manifest the symptoms within your gut. It could be a nausea, it could be some bloating, feeling gassy, or it could be discomfort that grows, gets more intense, and turns into waves of cramping abdominal pain that will fold you over, right? There's varying levels of intensity. But I know, like, I'm sure that you've experienced this at some point.
For sure.
Yeah, and me too. And like, I remember in medical school on test days, there was a line at the bathroom door because it was such a pressure cooker that we were working in. So that's the result of this entire process, right? That's a true manifestation of the brain-gut axis. But now let's apply this, if we could, to irritable bowel syndrome. All right, so it's just like from a symptoms perspective, making the diagnosis, we talked about abdominal pain, and we talked about having diarrhea or constipation or both. What I'm saying is that what's happening in your brain can affect gut motility because it's affecting the muscle cells that line your intestines.
And gut motility means?
Gut motility is the way that your intestines are constantly moving. So each one of us, we have 20 to 25 feet of intestine. So 7 to 8.5 meters of actual intestine. And it's constantly moving, right? But it can move in ways that are in rhythm, that will propel food forward and allow it to digest. Or it can be in a pattern that is not in rhythm and spastic and out of control, and then your body feels that. And many of the discomforts that we get are the result of abnormal gut motility.